All right. Well, thank you all very much. My name is Jamie Lagarde, President and CEO of Sedera Health. We appreciate you taking the time this afternoon to come listen to what we do. We're going to talk, we're going to talk about this slide since it's an overview of Sedera. Got more things in there than that because I want you to at least have a takeaway of some things that are going on in the healthcare industry that I hope you will find valuable. So let's go ahead and get started. By the way, if you haven't left your business card in the bucket, I know, so I'm gonna ask my teammates to raise their hand in the back. I've got Bill Thomas and Julie Silverman. They are collecting cards. We will give away the Alexa at the end of the presentation. So, all right. This is not a big surprise. I don't know about you, but I'm tired of hearing about our broken healthcare system. It's in the news all the time. It's in the newspaper every week. There was a big article that came out in Time magazine several years ago, but it was kind of like one of those milestone articles about what's going on. And there's problems around the cost have skyrocketed. That's the #1 issue. Access has been restricted because many times when you're trying to control cost, you restrict access. And it's just growing frustration for both employers and employees. That is really well understood, I think, by everyone at this point. I love this cartoon. Doc, can you see the problem? I'm afraid so. You know, we're a big believer that the only two people who should be in a doctor's office is the patient and the doctor. And that the third-party payer, whether it's an insurance company or someplace else, is there to help but not hinder that transaction. And so this is unfortunately what doctors spend a lot of time dealing with, how to get something paid or reimbursed or covered, okay? We call what's going on in healthcare for employers. This is, now you hear a lot in the news about individuals trying to obtain healthcare, and Sedera is really an employer solution. We can help individuals, but through a partner company, we don't work with individuals directly. If you know someone who's looking for a healthcare option, yes, we can point them in a direction, but we're really employer focused. And so we like to call this the unsustainable squeeze, because those are the employees in the vice. But look at the graph since 2008. The red line is wages, which from 2008 to 2017 have increased by 19%. Total premiums have increased by 55% in that period of time, but the employees' portion has increased by 70%. So as the temperature's risen in the pot, the employers have had to shift more of the cost burden to the employees, and that's why we've got higher deductibles and things like that. The cost, this is not sustainable. Something has to change. How many people have heard of the Surgery Center of Oklahoma? I know my team has. That's not fair. You're not supposed to raise your hand. Part of the problem with costs is they say, well, you don't know what something's going to cost. You can't have a true cost for a procedure before you go in. Surgery Center of Oklahoma since 2008 has been listing their prices online. You need to have a knee scope. It's $4,262.00. Right? They have true costs, and they know procedures are different for John who came in or Sally, but they've studied their cost over a period of time and can give you an accurate cost for what you would pay to come in, and they know their quality data. And so some would argue that so I'll give you an example for a member. And the example I have up here is for a hernia operation. We had a member in North Carolina who needed to have a hernia repair. And they called around to North Carolina to find a place. And with Sedera, you have the freedom to choose your own providers. We don't tell you where to go. There's no concept of in-network, out-of-network, and we'll talk a little bit more about that. But they were looking for a good price. They're part of our healthcare sharing community. And the best price they found was going to be roughly about $35,000 for a hernia repair. And so we said, well, I'll tell you what. They called us on the phone and they said, well, yeah, sure, you could do that. That's your choice. But how about we do this? How about we fly you into Austin, Texas, where our headquarters is. There's a great, and it could have been the Surgery Center of Oklahoma. It could be places all around the country. But they fly him in with a friend, put him up in a 5-star hotel, go to one of the best general surgeons in town, They stay there for 4 or 5 days and then they fly home. Total cost all in, and I kind of gave away the punchline here, instead of the $35,000, there's $6,000, it was $6,000 total cost, flights, hotel, everything else. So as a sharing community, and we'll talk about what a sharing community is, it's literally we're sharing each other's medical bills. $35,000 versus $6,000. That's, why is it? Why does healthcare work that way? Why can I go see a radiologist for an MRI and go to the same radiologist, same machine, and pay $400 in an outpatient clinic setting that's not owned by a hospital, and go get the same machine, same doctor, same radiologist, and it's in a hospital setting, and pay $4,000 for it? Those are some of the examples of what's going on in healthcare. Who's incentivized to control costs? The agents aren't, the insurance companies aren't, and the hospitals aren't. So it's up to it's up to the employers. It's up to us, okay? So for Sedera, this is one of the statements we have on our wall. Who said the only way to pay for your health care is insurance? What we all need is health care. Health insurance is just one way to pay for it. There are countless examples, and we'll talk about a few, examples of different ways that you can pay for health care for a good portion of the healthcare stack, everything from basic primary care up further than that don't involve insurance. We've got to do something, okay? We're all familiar with what happened in the transportation industry, right? The way to get around was the taxi cab if we didn't have our car and we're in town. Now we've got Uber, now we have Lyft. We have other solutions, we have car shares. That industry went through a disruption. Taxi cabs have their place, but why should we be limited only to one way to pay for healthcare, which is health insurance? Okay? This is the market in healthcare, and this is why I think this really needs to be driven by employers. So of this graph, the purple is government. The blue is a form of either group or individuals. And the non-group portion of this, as you can see on the graph, is 22 million people. About 15 million people get it through an exchange, and a healthcare.gov or a similar site. The vast majority, it's roughly about 166 million people, get their healthcare from employers. That's where we can make a big change in healthcare. So, how does Sedera fit into all this? So we have 3 objectives when we work with employers. Number 1, we create a compliant solution. No one's getting fined. Number 2 is that if you want to really have an honest conversation about healthcare, you've got to control 2 things, not just one. I was on the buyer side before I was joined and helped start the Sedera team. I was on the buyer side of healthcare, and the insurance agent would come in and he would say, look, we've got an 18% price increase, but if we raise the deductible, raise the copay, and shrink the network, we can get that to a 7% increase. That's just moving money from one bucket to another. If we really want to make a difference in controlling healthcare, we've got to look at both sides of the cost coin. We've got to lower the monthly cost of healthcare, and we've got to lower the out-of-pocket as well. That's how we can really help people. And with Sedera, we're accomplishing all 3 of those things. Usually we're walked in, not always, usually we're offered alongside another option for employees. So Sedera, a lot of people haven't heard of us, right? Medical cost sharing is new for people. Now if you look at it as an industry, and we'll talk about this in an upcoming slide, there's now 1.2, 1.3 million people that have joined one of these sharing communities if you added it all up. So a lot more people know about it now than they did just even 2 or 3 years ago. But some people have had United Healthcare, Blue Cross Blue Shield, and those are fine products, but people like having options. So many times we're offered side by side other options to choose from. You've got insurance options and you've got non-insurance options, okay? So let's go into a little bit detail. What exactly is Sedera? So imagine we were all sitting around a table. What is healthcare sharing? We're all sitting around a table and we all agree to put $200 in a bucket every month. And if anyone has a need, a medical need that needs to be shared with the community, they need help, right? After a certain threshold, let's say it's $500 for that need, they come to the community bucket and they take out the money they need. That's what sharing is. in its simplest form. And we facilitate that sharing, and one of the key things we do is we make sure that the community, which is all of us, is getting a fair price before the community then. We make sure we get the $400 price for the MRI instead of the $4,000 price, okay? So that essentially is what sharing is. It's a community-based approach in a highly organized way where we're sharing each other's medical bills. It's not insurance. It's just sharing, okay? Usually there's big savings over health insurance. Just to give you an idea, I would say now this year, when we run we'll do a side-by-side comparison for folks, and they put what they're doing with their health care, either their renewal or what they paid last year. On the low end, it's 35, 40% in savings. In some cases, it's up to 70% in savings. We've already talked about industry-wide. If you added up the sharing that's happening in these communities, it's well over $1 billion. In 2018, it's going to be well over $2 billion. We've got members with cancer, we've got premature children, we've got heart attacks, the stuff that, frankly, we get worried about. Yes, sir?
Yeah, I don't know if you wanted to have questions. How do you mentioned the example of a $400 MRI versus a $4,000 MRI. Do you do the negotiation? Does Sedera do the negotiating?
It's a great question. So what we've got, when we find out that someone needs an MRI, and our members will call us. So everyone who joins our sharing community, we have an advocacy team. Think of them as like your healthcare coach. Most of our folks that join, they've been used to the world of insurance. And when you join a sharing community, you're moving into this camp, and you're part of you're becoming a self-pay patient, which may sound kind of scary, but it's actually incredibly powerful as a self-pay patient to be able to control costs and really kind of see under the covers of what's going on. I'll tell you a story. The first time my wife used this, I have 3 boys. My wife and I are on Sedera with our 3 boys. We have a 7-year-old, a 4-year-old, and a 2-year-old. 4-year-old's almost 5. First time we used it, she was on the way. She wanted to make an appointment because she had this spot develop on her cheek. She thought it was cancerous. She got very nervous. She went to one of the best dermatology places in Austin. She got a self-pay price, walked into the doors. All she did was walk in, and if I got my cards here, she walked in with her HSA card. If you're familiar with a health savings account card. So you can have an HSA with Sedera, and we can talk more about that later. But she walked in, got a great self-pay price, gave this in. She's a self-pay patient. She walked in, the doctor said, first of all, that spot's not cancerous. You don't need to worry about that. But we can make that spot go away. This is great. Well, how do we do that? And he said, well, I've got this little cream. You put on it for a few weeks, and it'll go away. And she asked the perfect question as a Sedera member. And she said, okay, that's fine, but I'm a self-pay patient. What is that going to cost? The doctor said, I don't know. Let me find out. Dr. Leff came back and said, that little vial of cream is going to be $600. Now, she had $600 on her HSA, but she said, okay, well, before I spend that, what are my other options? She said, well, we could just burn it off right here, and in a few days, it would just flake off and it would go away. It would take 10 seconds. And I said, okay, great. She asked, well, what would that cost? And she said, about $50. She said, okay, let's go with that option, right? One of the problems I would say that is wrong with healthcare is we've turned it over to a third party. We're not involved in healthcare like we need to be. Just like when we go to the grocery store, it's the only industry where you go in to have services and you don't know what the cost is going to be. Imagine going to get an oil change and not knowing what the price is. And they come out and say, oh, it's $400 for the oil change. Well, how can that be? That's some of the things that can change. We can change that, and it is changing. So that's one example. And I hope that help answers it. But let me answer the second part of your question, which is yes, Sedera, our team, and our really our parent company, who we spun out of, the Curative group that's worked with the sharing ministries for the last 20 years, handles all our medical bill negotiations. So they do a great job for our members, kind of turnkey white glove service of hey, thank you for sending those medical bills. They take a picture on an app of the bills that gets it to us. If we have any follow-up questions, we call them, and then we pick up the phone and negotiate with the hospital and get that price down. Once that price is down, is negotiated, then we share it with the community and we write the member a check. We don't pay providers. Sure.
I had a recent experience of having an emergency need where you can't talk
Sure.
But it, the insurance price of it was huge.
Right.
Right. Of course, I didn't have to pay it because the insurance company paid it. But if I was on your plan and had this emergency thing.
So let's talk about, this is a great question. So like I said, I've got young kids, so I got plenty of examples. We went to the hospital because my son had sliced his hand on a mirror. It was just wide open, and my wife just rushed him to the emergency room and called me on the way. This is a Sedera member. They immediately started taking care of him, and at some point in time, one of the administrators came over and asked the question, "Can I have your insurance card, please?" And I said, "Actually, I'm a self-pay patient. Here's my HSA card," right? Or I could have just pulled out a credit card. I pulled the wrong card out. But here's my HSA card, right? You can take up to $500 from that, and the rest is fully shared with the, I said, you can take up to $500 for that, and then bill me for the rest, is what I told her. And she said, "Oh, I only need to take $200 from you today," and she billed me for the rest. So our members don't have any problem in emergency situations. All right? In an emergency situation, that isn't the issue. They have an authorization, a requirement to treat you, and we haven't had any issues. We've got members in 44 states, and this has not been an area of concern.
So then what you're saying is that the company, which community pays for the rest.
Correct. So
$200 copay, and then the company pays for the rest out of the community.
So the way it works is Sedera looks at everything in terms of a need or an incident, like a car accident or a serious cancer diagnosis or having a child. And you're going to pay your initial unshareable amount. And you pick it at the beginning of the plan year, right? It's either $500 or $1,000. So in the case of, let's say, we had a premature child who was born, spent 3 weeks in the NICU, ran up $170,000 in medical cost. The member paid $500. That was their IUA they chose. And then the rest was fully shared with the community. So the member had zero out-of-pocket cost. Now, we negotiated that $175,000 down to $40,000. And then we wrote the check for $39,500 to the member, and they paid the provider, the hospital, and the anesthesiologist on a credit card so they could get points for their next vacation.
So what happens if it was $1 million baby? Because in my career, I've had about 4 of them in my book. So what would happen in that case? I've got right now twins.
Tell me your background then.
I'm a broker.
Okay. So we work with brokers all around the country, and yes, there is the hemophiliac example. There is and that's where Curativ's 20 years of expertise in negotiating those bills have been so incredibly valuable. So
in that case, like it was $1 million baby.
Right.
And then there's a lot of after.
Sure.
Little one, he had to have surgery, have his brain removed in one of them, and so he actually was in LA Times for 3 years in a row.
Right.
Every year at his birthday, because he had lots of other issues. So, he hit $1 million just from the hospital.
Right.
And then afterwards, it was ongoing.
Mm-hmm.
So, in that case, there's no limit.
There is no sharing limit. Now, because it's just sharing, it's just the available funds in the community.
Okay.
But
Pay the whole amount, and the member would only pay $200.
the member's going to pay the $500 one time, because so I'm going to give you an example of a few needs, but in that case, that all would be considered one need. You'd have paid $500 one time, and the rest would be shared with the community. Now, Curative would negotiate that $1 million bill down just based on historical percentages, south of $200,000.
With UCLA?
I don't have that data. I don't have that data.
I can see that with some hospitals.
Well, I mean, remember, you're a self-pay patient, so we can talk more about that. But as a self-pay patient, that's I'll put it this way: hospitals, so looking at the data in Austin, Texas, hospitals are charging gross amount 760% of Medicare, plus or minus, and they're paying out, depending on insurance, this is insurance contracts, 130, 140, 150% of Medicare. That's just what insurance is able to do. So in self-pay patients, we're in many cases able to get that much lower, and the community would easily be able to share that. Okay? Let me go through a couple of other things here. There's no freedom. There's no in-network, out-of-network. to concerns here. We don't tell people where to go. We may incentivize them, like the hernia, for example, but if they wanted to stay in North Carolina, they could have done that. We're not restricting them. And it is a healthy lifestyle program, so we'll talk more about what that means. How am I doing on time?
Yeah, about 20 minutes.
Great, thank you. This graph just shows the growth of healthcare sharing as an industry since the Affordable Care Act was passed in 2010. The what? Oh, well, I'm not going to argue with you there. And so this trend of healthcare sharing as an industry, it wouldn't have a growth curve like this if it wasn't working for the really big things and the small things, okay? So let's get into chronic because we'll talk about pre-existing and things like that with it as well. So we generally look at healthcare in 3 buckets. So there's large cost, small to medium cost, and preventative. Right? Those are really the things how we try to categorize it. You know, examples of large cost are like that cancer diagnosis, having a child. We get a lot of pregnancies with Sedera because you can have a child for $500 and the rest is fully shared with the community. You know, small to medium things, colds and sinus infections and things like that, and then preventative care. You know, your childhood vaccinations, mammograms, colonoscopies, preventative once you're over the age of 50. So those are the 3 buckets. So let's narrow in on what people really get concerned about, and that is around large stuff. And so we have a special term that we use. It's called a need, and I mentioned it earlier. A need is 1 or more medical expenses caused by a single accident or illness. You have that IUA, that initial unshareable amount, and that's what members pay before sharing begins for the need. Needs over that IUA, that 500 or 1,000, depending on what you picked, are then fully shared with the community. So usually we get somebody who says, well, gosh, is that up to $500 each time? Suppose you don't understand my family, we're constantly running into trouble. Is that, you know, I got a need this week, I got 1 last week, and I had 2 last month. And so the reality is we put a cap, 3 for an individual and 5 as a family. If you've had 3 active needs as an individual, 5 as a family, then just send us your medical bills. We're sharing it at a 0 IUA, meaning right away. This feels good. Very few people take advantage of that in our community. The reason is that so it feels kind of like a maximum, maximum type of number, but it's usually 1 or 2 things any person's dealing with at any point in time, right? From a healthcare perspective. So that last bullet's there, and that's how we will. If someone has a 4th need, then that's fully shared, but starting at a 0 IUA. But again, very few people take advantage of it. Active. So let's walk through this example and I'll show you what this means. So for example, a family's 1-year child had a persistent ear infection on an insurance plan, and the deductible was $5,000 per family. This was my middle son. I like using my family examples because I know them really well. We did a series of antibiotics and booster injections. Ultimately, we saw a specialist and they put tubes in his ear. Okay? All in all, with insurance, that cost about $2,500 out of pocket. We had co-pays, in-office injections, and that's where the $2,500 came from. If we would have been on Sedera, all of this would have been looked at as one need, and we would have paid a little more, probably, for some of those early costs, but then the community would have kicked in, and we would have paid $500 for that whole experience. Now, when this happened, this was October. Okay, when we had to put tubes in his ears. Come June, one of the tubes fell out. New plan year. We all know what happens on New Year's Eve with insurance, right? Happy New Year. Don't know why we celebrate that, but we do. But the deductible had reset to 0. So we had to replace the tubes in June. It was another $2,500 out of pocket. It actually happened a 3rd time. So we spent almost $10,000 on his ears. Wasn't, well, maybe 8,000, 9,000. So if we would have been on Sedera when all this would have been started, okay, we would have paid $500 the first time. How much would we have paid to replace the tube? Who thinks it's 500? You're right, it's 0. The reason is because it's still considered the same need. It's only when you go 12 months of treatment and symptom-free is the need no longer active, and you'd have to pay another IUA, another $500. Okay?
How does the economic model work for the company to stay in business?
How do we make money?
Well, I mean, or how are you, yes, and how do you, if this is spread over a large number of people, you know, the insurance companies who I believe think they know what they're doing are charging $2,500 and you're charging $500. I'm just curious how it works, how the economic model works.
So this gets into the whole philosophy of sharing. I mean, there's a 30-year track record of success of whether you look at a ministry or us, that, you know, the rates that you're seeing from the ministries in the last, you know, the first ministry opened in '81. So this is a proven, like a Samaritan Ministries or a Medicare, this is where this model started. Medicare, probably most people know, it advertises on the radio, and those solutions are really designed for individuals, and they do a great job. They really do. We're the only healthcare sharing organization that targets businesses. Okay, and we remove the faith restriction. Even though we're a Christ-centered organization, this is, as I mentioned before on stage, this is really our mission field. We said, look, we want to be an example of biblical principles, and we're not asking any faith questions. We're just going to open this to everyone and let them participate. Just like the Christian church, you know, many say invented the hospital. I believe that the Christian community is leading the way to solve healthcare in this country. Yes, ma'am.
So I have a question. It looks like you have two separate types of plans, right? Because you were talking about having an HSA plan. So what is your deductible? So then if this is a $500, if you have a health savings account, you have a minimum
So that's an add-on piece that has nothing to do with sharing if you've got an HSA. We'll talk about that in a minute.
It doesn't look like you're comparing two similar plans.
In this case, regardless of whether you have the HSA or not, it's still $500. Okay? So
you don't have a deductible?
The $500 per incident is essentially a per incident deductible. We don't call it that. So from an insurance perspective, it's almost like the way to look at it is this in no way contributes to HSA qualification. This is not insurance.
So it's not an HSA per se?
This does not allow you to, from a technical perspective, it's another piece that gives you the HSA, not this. Okay?
Because an HSA is governed by the IRS.
Yep, it's a whole, there's 250 companies with Sedera that are having an HSA, and we know that they know those rules very well.
Completely agree that when you break the arm's length transaction, distortions occur. That's kind of essentially the premise. However, once you hit the $500, isn't your company just acting in the same? So what's the incentive for the individual to continue to ask the questions?
It's a fabulous question, and it's something we work on all the time. It gets around how do we keep the member engaged to want to do the right thing for the community, right? To pick up the phone and say, what is the better option? So we incentivize them through carrots, not sticks. Give me a couple of examples. We give them, you know, one of the things that we do is we give everybody a telemedicine service. That means access to board-certified physicians, pediatricians, and dermatologists anytime, day or night, 0 cost. And so when you've got something small going on, why would you go wait 2 hours in a doctor's office for the prescription, the same prescription you needed 2 years in a row? You know what's going on. Why not talk to a doctor over the phone? Doesn't cost you anything. He calls in a prescription for you that you pick up on the way home from work. Okay? So let me do this in the interest of time. I'm going to move through my last slides and save any of the questions for the end because I want to make sure I wrap up because I feel like we've gone 75% around the circle. And I think getting around the rest of it, I think, will help. It is a healthy lifestyle company, so what does that mean? I said our members believe that smart choices, diet, exercise, lifestyle can greatly improve your quality of life. Our members believe that, when like-minded, healthy individuals get together that care about their health, we can reduce cost. Our members commit to certain things that are important, that are required. No use of illegal narcotics, no driving while intoxicated, and tobacco users can join, unlike with the ministries, but you pay an extra surcharge for joining. While driving while intoxicated, what that means is if someone was intoxicated, got behind the wheel of a car, got in an accident, for the driver, the medical bills would not be shareable. So there is a strong element of personal responsibility here. There is an exception for an underage driver, who's still trying to figure out good decisions. But for passengers in the car, it would be fully shareable because they didn't make that decision. Okay. We look at medications. Let me just make sure. Yeah, we look at medications in two categories. So there's curative medications and maintenance medications. Curative medications, the same sharing rules apply. It's just part of the need. Maintenance medications, we look at that as a separate category, and it's shareable for the first 120 days. Examples of this would be like a high blood pressure, high cholesterol medication, something like an acid controller that's shareable for the first 120 days after a new diagnosis. But after that, we give you a wealth of resources to get maintenance medications at significantly discounted prices. Okay? That works really well for the majority of our members. If someone's on a really expensive medication, there's a buy-up piece that can help there too. Let's see what other things to mention. Pre-existing conditions. All of the sharing ministries and us, we have limits on pre-existing conditions. We like to say Sedera works for 8 to 9 out of 10 people. Okay, that's another reason why Sedera is usually offered side by side. Something else. So what common pre-existing conditions: high blood pressure, high cholesterol, sleep apnea, and non-insulin dependent diabetes. If that's well controlled, it's fully shareable on day one of your membership. Outside of that, we don't tell anybody no, but pre-existing conditions, there's a time limit on when they can be shared. I joined with pre-existing conditions. I know one of my coworkers did as well. So it works for a lot of people, but if someone's dealing with an ongoing current cancer diagnosis, year one no sharing for that condition isn't going to work, right? So that's just an example. That's why we say it works for 8 to 9 out of 10 people. And the sharing ministries work the same way. So we build a couple of things in to kind of help manage costs, as you were talking about. We build that teledoc service in there. The first time I used that, I had a sinus infection, called my doctor. He couldn't see me for a day and a half. I didn't want to wait that long. I called Teladoc the first time, spoke with the doctor for 5 minutes. He called the prescription in for me. I picked it up on my way home from work. Doctor consultation was $0, was right away, and the prescription cost me $15. So it's great for the small stuff, but it's not for everything. We want our members to have access to the best healthcare. And so we build in a service called 2nd.MD. I'll just tell you right now, it's not cheap, but it gets you access to doctors at like Johns Hopkins, Mayo Clinic, Cleveland Clinic, places like that, leading experts in their field. The average specialist, they have data that says the average specialist is 17 years behind on their training. The healthcare industry is $3.4 trillion, plus or minus a billion, or a few billion. Up to a third is not necessary, okay? So we want people to, if they need the care, 2nd.MD is not incentivized to tell somebody no or yes. We do require our members to get a second opinion on big stuff, but they're free to choose and do what they want. They don't have to follow the second opinion's advice. We just want our members to have that information before they make their medical decisions. We want them to have access to the latest healthcare. We build in a counselor service, and then we, of course, have a coach to help you navigate the world between insurance and non-insurance. Thank you. HSA, again, let me explain how the HSA works. So many times our employers, and this has changed a little bit now that the individual mandate has been repealed, Sedera by itself doesn't meet the individual mandate. Now that's going away. But when we work with our industry professionals, they'll say, hey, Sedera is really interesting, but think of it like the motherboard of a computer. We need a keyboard, we need a mouse, we need a monitor, and so they put other things with it. They'll put a dental and a vision plan with it. They may put a disability package with it. And they may sometimes put some type of thin insurance layer with it, okay? So one of the thin insurance layers is a modified high deductible. It's not our product, but a lot of our members like it, where it's a modified high deductible plan, which allows for them to have an HSA, and it gives them preventative care for the colonoscopy and the mammogram and things like that. So this, it's only the insurance, to go back to your question. Sharing can't give you an HSA. It doesn't meet the IRS regulations, but the high deductible plan can. Okay? So I'm going to stop. We got a couple of minutes left. I know I've hit you with a lot of information, but let me just to kind of summarize it is there are healthcare expenses have become such a massive expense, not only for companies, but for individuals. There are trends around telemedicine, as we talked about for the small stuff. That's not insurance. There's these relationships called direct primary care, where you sign up a monthly membership fee and you see the doctor for primary care, and there's no insurance in there. The expert second opinion is another example. That's not insurance. And then we've got medical cost sharing, and a track record going back to 1981. So there are other solutions that are out there for taking care of healthcare, because we all need healthcare, but maybe there's other ways that work for your employees that don't include health insurance. So that's it for me. Questions, thoughts?
Are you in all 50 states?
We've got members now in 44 states, but we have no restrictions on states that we operate in.
Do the states?
No, there's a carve-out for the ministries in the Affordable Care Act, and 31 states also, 30 or 31 states have safe-level safe harbors, which say sharing is not insurance, but because the federal designation came out from the ACA, that's really what people look at it as. Yes, ma'am?
Do you cover durable medical goods?
That can be shared as part of a need, yes.
What about long-term health care for somebody who's ill, somebody with Alzheimer's or?
So it would operate pretty, in the specifics around that, I'd need to check. It's not something, an example that I know well. We have on our front page of our website, we have a guideline document, which goes into, it's the membership guidelines, and it's about 50 pages, and it explains, I'm glad you brought this up, because let me explain this element. That 50 pages describes how the sharing community works. And it's really not our sharing community, it's the community's sharing community. So we use that guidelines as our determination of how to share something. Now let's say we got it wrong, or a member disagrees with how we've shared something. They can appeal, and the appeal process actually has nothing to do with us. Except that we pick randomly 7 members of the community, and we put them in a room or a conference call, and the member talks about the situation. If 2 of the 7 members say it should be shared differently, we share it the way they want it.
Are your communities based on overall, all over the states, or is it per state?
Great question. No, we are all join one community. So the members who join, we have one nationwide rate structure. So whether you're in California, Texas, or Florida, the rates go up and down together as a community. So and so the whole community works together to share.
And I'd like to add to that. So our prices are transparent on our website. So if you go to Sedera.com, the prices you will see, there's no underwriting. Okay, so you go to our website, our prices are on there. We haven't had a price change since 2015. And our prices actually went down in 2015. Now, will they go up eventually? We have mechanisms in place. I know, talking to somebody about the hallway, there's some concern. Is there going to be enough money in the bucket for these big catastrophic events? And the answer is yes. There's no guarantee, but however, in the 3 years that we've been in business, we've met every need that's come through the door 100%. Everything that fell under the guidelines, we've met at 100%. Also, we set aside 15% of all monthly contributions into what we call the Large Excess Needs Fund, and we have not touched $1 out of there since inception. Thirdly, I will add, when those large excess needs come to our doorstep, and they're, as you mentioned earlier, we have babies in the NICU, we have cancer patients. We don't just get $1 million bill that's slapped on our door. They're coming in $30,000 increments, $45,000 increments. And so our CARES group, our patient advocacy and billing negotiation, is able to handle those behind the scenes. So when you do get a check for a negotiated
going back to your question about how are we able to keep our prices so low? Those stipulations around pre-existing conditions, unlike insurance companies have to take all. We take all, but we put some stipulations on sharing in that first year, and that's what's able to keep our rates so low. Are you profitable?
We are. The way we make money is if we don't share, we're not incentivized not to share. We make a fixed amount of money per person who joins. If we want to make more money, we have to have more members. And so the incentive for us is just to grow the community, of course, but we're there to, if we pay out $100,000 one year, or we pay $5 million one year, it doesn't impact our profit and loss statement as a company. Yes, ma'am.
Can you give an example of somebody who this would be beneficial?
Someone with a current cancer diagnosis that they're battling with right now, since there would be no sharing on day one of their membership or the first year, they wouldn't be a good fit.
What about somebody that has a pre-existing condition that's a chronic condition? That's going to be like a lifetime condition?
It really depends upon the condition. We have type 1 diabetics that have joined. It's yes or no whether we're a good fit. It just really depends upon the person and the circumstances, and we're happy to talk to them about it. We have a fair number of asthma folks that have joined and said, you know what, I know how to manage my asthma. I can deal with the time restrictions. So it really depends on the person and the condition. But it is something, it's not a just yes, it's a good fit. Yes, ma'am.
Since it's not compliant to the ACA rules, you're saying.
Well, let me clear that up. So if it doesn't create, so the overall solution when we work with a broker or a healthcare professional, if there are compliance concerns, so even though the individual mandate's gone away, for large employers, they still have the employer mandate. So the overall solution when working with a healthcare professional does meet their compliance concerns.
Okay, because pre-existing is one of them that you can't ask for. So anyway, and that was, my question was, what you were saying that you, as an employer, it's kind of scary a little bit, but if you could offer, you were saying with another carrier, so what other carriers are allowing to be offered with side by side with you?
So we've got a growing number of brokers that are offering this side by side other options. I'm happy to have you talk with them. We provide sharing.
Yeah, no, I'm not what carriers, not brokers, so I'm just like.
Well, they would know. I mean, so it just, yeah, I mean, it depends upon the state. I mean, I've heard of situations with Blue Cross Blue Shield, with Humana. I mean, a whole list of those. What's that? Medicare, some people will take this and use this as a supplement. I would say for somebody over the age of 65, and they'll keep Part A, Part B, and Part D. I mean, you can't be the best thing for, I actually think we're not the best supplement plan. I think you're overpaying for us. I think you're better served. At some point, we may offer a Medicare supplement sharing program at a lower cost, but that's not on the drawing board for this year or next. And I would point people to, they're great insurance options as a supplement. There's also a sharing ministry that does have a Medishare supplement sharing program. Medishare has that. But I don't think Sedera, it's probably about $100 over what you would normally pay. Do we have folks that have done it because the company is so sure we'll do that because they're saving so much money doing it? Yes, absolutely. But it's not something we are actively promoting. People just decide to do it because they want to. Yes, sir.
Can you clarify with the high deductible healthcare plan, is this an insurance plan that's purchased together with Sedera?
Yes, it's like they're so sharing is so sharing is a completely separate thing and doesn't act towards compatibility. It doesn't meet ACA requirements for having insurance. Now again, the individual mandate's gone away. So we as citizens come January 1st of 2019 don't need to have insurance. So you can just take sharing by itself. But the people who still have obligations are employers that are over 50 FTEs, meaning over 50 employees, right? And so many times they will buy Sedera and an insurance plan to meet some obligations. Okay. No, this is about $50, $60. So the total, so when we say that they're saving 40 to 70% on their healthcare cost, it's including the cost for this.
So you only work with employers, you don't work individual
We send individuals to a partnership, yeah.
So give a day when the company turns over to Sedera. How does it work when you start onboarding your employees to a new program like this?
Well, you start a month to 2 months in advance around education, webinars, email campaign, getting them used to that, and you do one or more enrollment presentations so that they walk through that, and then everyone gets a welcome call on the backside.
But do you have to go through any kind of testing and medical record?
So good question. You fill out a primary member application, which does ask some health questions.
Does your company come and do all those presentations?
So to answer your question, Susan, for your company side, yes.
For-
We're dealing with companies 5 and 10. So we have 150 certified brokers. So we need an agent of record in every deal we do because we're not licensed insurance agents. So every time that we sell a group, we have to get one of our certified brokers to, and I'd say 30 of them I feel comfortable enough showing up at your site and producing Sedera in a good manner. Otherwise, we would be there on staff, especially for a company of your size.
Yes, sir, and then last question, and then we'll do the giveaway.
And then, yeah, if you haven't given me your card, please raise your hand. We're giving away that go.
So, obviously, no contracts says you can go anywhere, right?
Right, yeah, yeah.
Instead of the provider to negotiate after the fact to a rate that they've already charged, to a lower rate than they've already.
So in a doctor's office setting, if you walk in just for a visit, you're walking in with a credit card, whether it's an HSA or just a regular standard credit card. They look at you as there's no paperwork to fill out. They're getting reimbursed right now versus 8, 10, 12 weeks later when an insurance company would reimburse them. And so that's like money now. And so the average, for a doctor's office that doesn't take insurance, for one provider, there's one back office person. For the average provider who takes insurance, for one provider, there's 3 back office people. So you are saving them money. And so they're happy to give you a discount. That's in the doctor's office setting. All right, pick someone. You can't look at them.
People in the door stuck at the bottom. Okay, good luck.
Thanks. Well, my card's not in here. Luck. Okay. 2 miles. Miro? Hero. Hero. I need to. There we go. My eyesight. I need glasses. Too bad Sedera won't share that. Congratulations. Thank you for coming.
Thank you.
Well, I'll stick around if anyone has additional questions, but thank you all very much, and I hope this was informative.